Hey guys, welcome back to Medical Coding with Blue. It is Q&A Tuesday. You guys are getting a double dose today of me. So, all right. One thing I wanted to also address for the interview tips. When you are being asked a question, don't just say yes or no. Usually follow it up with something to expand on that. Okay, this way it's not just one word answers, okay? The interviewer needs to know that you are engaged in this meeting, that you are excited about this potential employment, and that you are going to do everything you can to put forth a good first impression. So, that is also another tip, is to expand instead of just saying yes or no answers, okay? All right, so let's go ahead and get into the questions. Number one, what does PFISH stand for? PFSH. That is past family social history. All right, I want to address this because it's very, very important. These acronyms, you have to know, okay, or abbreviations, you have to know, okay? You need to know these because it's very important. When you're reading documentation, you are going to see a lot of these, okay? So PFSH is past family social history. All right, and you will learn them after a while, okay? MDM is medical decision making. HX is history. DX is diagnosis. So make sure that you brush up on all of those, okay? Because they are going to be a regular part of your daily medical coding life, okay? So a good thing to know. Number two, how does an employer gauge work experience? Well, a employer is going to gauge your work experience based on the time you've spent doing whatever it is, whether it's coding or whether you've been working in like a medical front office, things like that. That's how they're going to gauge your work experience. You're also going to be giving a test. You're going to be given a test when you first apply for any medical coding job, okay? Because they need to know that you have the chops to look through a book and find the answers and work on just different cases and things like that. Sometimes they will give you a little 25 question test. Sometimes it'll be 50 questions. Sometimes you'll get like surgery scenarios, and other times it'll be like multiple choice. It all goes back to navigating in the book because you will have to code. They do need to see what your level of expertise is. This is why I always reiterate every single time that you guys have to study hard, and make sure that you're trying to understand. And if you can, learn different places that you can find answers to, okay? That is very, very important. Knowing where your resources are at is key to those moments where you're going to have to find answers very quickly, okay? Another thing I wanted to bring up too is work on taking criticism, okay? When you are applying for these jobs, and if you take a test, let's just say you don't pass it, okay? If you don't pass it, just at least ask them what it was what part did you fail on? Can you ask, would they tell you? Because sometimes they will, sometimes they won't. But if you failed on a certain part of that test, that's where you need to go back and really study some more, okay? Medical coding will kick you in the teeth, and it will mess with your self-esteem in the beginning because you'll think, oh gosh, do I really know what I'm doing? It takes a bit of learning to do, but you can do it. You just have to stick with it. Whatever you do, okay? Stick with it. And again, work on building your self-esteem when it comes to taking criticism or feeling like you don't have enough knowledge, okay? And if you're feeling like you don't have enough knowledge, dig right back into the books, okay? Do the Quiz Fridays on here. Even though they're not official, I am just a veteran medical coder sharing the things that I know. And this is real world stuff that I've seen. This is stuff that sometimes I hear my colleagues say that throws them off, okay? So I try to use those, or I try to use questions from my viewers that they say, well, I have a hard time with this, or I'm struggling with E&Ms. Can you do some quizzes about that? I do pay attention to that. Injuries is another one that throws a lot of people off. And I happen to really love injury coding. So that is where I am most strongest. It takes a bit of time to get strong in a lot of areas, but after a while, just stick with it and you will. It's like I said, it's going to take a minute to get used to, but once you do, it's going to be a lot of fun. Okay. All right, next question. Where do I go for more information about medical coding? I keep getting this question. Google. Look up the two major medical coding associations, ahitma.org for the American Health Information Management Association, and aapc.com, the American Academy of Professional Coders. I have gotten this comment more than once, and I think that I've already addressed the question, and then I do specific videos about this question, and I still get the question. So I'm saying it again. If you are interested in the medical coding field, there are two major medical coding associations. And guys, I'm sorry if you've heard this 100 times already. Sorry. But there are two major medical coding associations that both distribute the medical coding credentials. Okay, there's the American Health Information Management Association and the American Academy of Professional Coders. Check them out. See which website says and has most things that are what you need. Check and look into the associations. The only one who can decide which association, which credential to get is you, okay? Each one of them has their own benefits. Each has their own set of doing things. I will always recommend AHIMA because that is who I'm through. I know that upsets some people, but it is the nature of the beast. You know, I know them. I don't know AAPC, okay? I know there's fine coders with both associations, so I'm not saying that one is worth over than the other. I am just saying that I know AHIMA, so I recommend AHIMA, okay? And that's it on that one. All right. Number 4. Now, I like this question, okay? When did I know I really started to enjoy coding for orthopedics? Okay, somebody asked me this, and of course, I have to answer the question. I think I really started to really dig into orthopedics, and it really started to be more of a joy rather than just this is another clinic that I code. Probably about the time when I really started having to work with Dr. X and really start to dig into learning and just doing more of those one-on-ones and things like that. It started then because as I'm exploring and digging into orthopedics and trying to understand the bones and the joints and things like that, it started to become more fascinating because I spent more time with it. Then at that time we were about to do that. It's like being on a roller coaster that into ICD-10. It was about that time. So it was unique. I had a unique situation happen when ICD-10, the transition happened. Okay. I was getting double training at this time because I was taking one course independently and I was getting trained at work. So what was really good was that it was like what was being explained at work during our time being trained there. If it didn't make sense to me, I had my independent program that I was going through. That was like the backfill for what I didn't understand. It was filling in the holes. So I got technically double the training when it came to ICD-10, which is what I think helped make the changeover for like the injury coding, because as you all know, we went through quite a change with injury coding from ICD-9 to ICD-10. And yes, I am dating myself. When I originally started, it was ICD-9, so I did have to learn ICD-10. And like I said, just having that time to be able to learn about sequela and learn about injury coding and initial versus subsequent versus sequela, it was a really eye-opening time. I really like learning. I enjoy learning. I enjoy teaching. Those are the two things that I like. And I like the fact that with my coworkers, I could share what I know. You know what I mean? And they, they were happy about it because a lot of them didn't understand, what was going on with the injury coding. And then working with Dr. X and having that good partnership with him, and then that translating to the other providers that I was working with at the time too, that really did start to develop more of my my, I guess, affection for orthopedics. So yes, that is, that is why, because I have sat in many different clinics, and I did code for psych. Psych is very interesting, but psych can be, it can it can get really complicated. Psych can get really complicated. I have coded for, and I'm very good with oncology. I don't. Um, it's not one that I like to do a lot of, though, and that is just, it's because it's, I don't know, it's just one of those clinics that I don't know. It's There's really no way to explain why I have an affection over one over the other, but I guess, I think what it happens is, a lot of times when these providers are documenting, I think that's where my problem comes into play. And especially if the providers are kind of closed off to wanting any assistance or any help or anything like that. And I think that that's the problem on that clinic, for me at least. But yeah, that's why. But orthopedics, yes. Podiatry, yes. And working with the bones and the injuries, that is what I like to do. All right. Next question. When you are applying for a job, are you allowed to pick which clinic you code for? Okay. So it's going to depend on where you're applying. Okay. And always pay attention to the job listing, because it'll let you know. Sometimes it'll tell you that you're coding for outpatient services, and then it won't tell you what specific clinic. Sometimes they do that because they're hiring maybe multiple people, and then they're going to decide where to put the people that they hire. You can ask, I would ask definitely, what clinic am I going to be assigned to, or what clinic position is this for? That's what I would ask, because this way you can prepare yourself, but always be prepared to get changed over and be put into a new clinic. You should always be prepared for that, okay? And whatever you do, don't resist. Just go with it, okay? I have seen so many coders that dig their heels in, and they do not want to try any other clinics. They don't want to learn and take the time to learn new clinics. I see that a lot. And it's unfortunate, because I think you're missing out. You're missing out on building your knowledge base. You're missing out on good partnerships with different providers. Had I been, very steadfast and, no, I'm not going to code for neurology, I would have never, had a good relationship with provider G. And it was, I don't know if you've seen the video yet, when I was talking about clinic changes here a couple of days ago. And, it was very emotional for me, because working with this provider, we had been through a lot together, and she fought me in the beginning, and she didn't want to do what I asked her to do, and everything was my fault. And, why was I making such a big deal about her trying to get all this credit? Because I care, and I want to do the right thing. And she had not had a good hands-on coder before. And that was the problem there. So that's why I always say, be open to learning new clinics and coding in different settings. Okay, whatever you do, don't always close yourself off, because there's people that do that, and I think it's unfortunate. So all right, next question. What should I do if all the job positions are asking for 2 to 3 years of experience? Apply anyway. Okay. And I say apply anyway, because when you are applying for these jobs, even though they're asking for 2 to 3 years experience, you never know if that job or that company or that hospital is going to be in such a jam that they will take a chance on you anyway. The only way for them to even know who you are is if you apply, okay? And if by some miracle, right, you apply and you say you have no experience, this is going to be your first job, they give you the test to see what you're made of, and you do really well, and then you go in and you do your interview, Hello. That's where you can be like, okay, this is where you start to shine. And doing these videos, okay, I hope you guys are watching them, because I did the 2 videos, the tips about the job interview, and then the questions that you should ask the interviewer when you are getting applying for jobs. Okay, this way, these are things from a veteran coder that has been in the field. And this way, when you go in there and you're armed with all of these questions and you're prepared, it's going to make you look really good, or at least help you to try to look good, as good as you can. Okay. So yes, go ahead and apply anyway. Don't let that 2 to 3 years stop you. Okay. I didn't let it stop me. And that's what our instructors had encouraged us to do too in the beginning, was even if you see 2 to 3 years experience, go ahead and apply anyway, because you never know. Okay. I eventually got my first job through a temporary agency. That was how I was able to get in. But there's still people that know who I am now because I applied. You know what I mean? Like, if I hadn't applied, they wouldn't have known who I was, And there was quite a few companies that were saying, you don't have enough experience, you have no experience right now, but if you just keep applying, we'll take a look at your resume again, when you do get some experience. And, that was fine. I mean, my journey in medical coding to up to where I am now has really worked out. Okay, it's really worked out. It's been a leap of faith. I talk about this all the time. It was medical coding that found me, and I have just sort of gone my way through this this career just by faith and just believing in myself and making sure that I'm just going with it even when I don't know what to do. And you're going to find those times where you feel like you don't know what to do. You're going to be like, gosh, am I doing the right thing? Just keep going and keep going with it. Okay. Whatever you do. Okay. And don't let anybody rattle your self-esteem or rattle your knowledge or anything like that. We were all new at one time, and everybody starts from the ground up. Okay. Everybody has to learn from the ground up, but it's going to depend on how much you apply yourself. And I say this all the time. Apply yourself, apply yourself, apply yourself. All right, next question. What other jobs can medical coders apply for? Now, if you are not able to get a job right away as a medical coder, you can apply for these other positions: accounts receivable, medical records tech, medical front office, insurance companies, anything in insurance companies, okay, and claims and billing, okay. Those are the ones that you want to look for in addition to applying for medical coder jobs, okay. Always make sure that you do put on there that you have your credential. This working in these other positions, okay, will give you some exposure to the medical field and medical coding, because even though these positions don't technically involve coding, they are in that field, so you are gaining experience, okay? And this is where you're shaking hands and getting to know people and making those job connections, because you got to start somewhere, okay? Some people have started in the medical records department, and when their hospital or their company was hiring for medical coders, they were able to make that seamless transition, even though they technically didn't have medical coding experience just yet. They still had spent time with medical records, so they technically now have experience, okay? So that is another avenue you can always go down. You can do medical front office reception, which somebody did recommend that, because then you're going to see that what happens in the front end, okay? What happens when they're bringing in patients, and how they organize the records, and using different computer systems and things like that. So that is a good place to start as well. But always keep in mind that everything that you do when you're working towards becoming a medical coder, all these other positions that you take in addition to, they're going to lead you to the people that are actually doing the hiring, okay? A lot of these are positions where the hiring people that do the hiring for the coders are going to see people in these positions, okay? This is when, shaking hands and getting to know people putting your best foot forward and really displaying the things that you can do, your good work ethic, those are going to be, that's going to be during that time, okay? And those are good qualities to always have on display, okay? Hopefully you do have a really good work ethic and you can show that you have a desire to be a medical coder, okay? So very, very important, all right? And last question. Are medical coders always expected to email the provider when they make changes to their evaluation and management levels, procedures, or diagnosis selections? Because as somebody brought up, isn't it dangerous when coders do not communicate with providers? Heck yes, okay? That's all I have to say on that one. Heck yes. If a provider, and I know I've been talking about this a lot, but I got to bring it up again, okay? If a provider is just humming along and they think everything's hunky-dory, they don't hear nothing from their coder, they don't even know who their coder is, they couldn't even pick them up out of a lineup, okay? To them, everything is fine. You have not said nothing. No one has said anything to them about their coding or their documentation. So they're thinking everything is cool. But then all of a sudden, when they're in a meeting and they have their numbers up on the Jumbotron displayed, not Jumbotron, but you know what I'm saying, to them it's a Jumbotron, okay? When they're ranking lower than their peers, you want to talk about madder than a wet hen, okay? They get mad when they see their production is really low. The first person they're going to blame, it's the coder's fault. It's the coder's fault for not picking it up. And then guess who's going to come flying into your office screaming and yelling? The provider. So it's always better, because they're eventually going to find out. If you don't talk to them, if you do not tell them, hey, I have been changing your levels because you're not meeting your points for your review of systems or for your physical exam or your past family social history, if you're not meeting your points and I have to lower this, but the coder is not telling the provider, that's not fair to the provider. They have to be told, okay? I'm going to do a separate video about dealing with providers who get upset, okay? I will do that one, and how to handle that, because that's going to take some finesse. It does take some finesse, but it's not impossible. I have worked with some extremely impossible providers before, and I've been successful 85% of the time, I would say. 85% of the time. And maybe that is a low ball figure, more 95% of the time, but I say 85 because, 85% of the time, because I'm going to be fair, okay? I am successful at converting a very steadfast, I am not going to do anything the coder says, to them being like, okay, she's working with me. She wants to partner with me. She wants to help me. She's interested in my coding welfare. I tell them this all the time. I am responsible for your coding welfare. If your codes are not coming out as specific or as level appropriate as they should be, the onus is on me, because I am not doing my job as your coder to tell you and make sure that we work together in order for you to document appropriately, okay? These doctors get taught how to document a lot of times very quickly when they're in school, but it's not about, like, they don't go into specifics because they're not meant to be medical coders. They say this all the time. I'm not supposed to be a medical coder. I say this all the time to them too. You're not meant to be a medical coder. That's not for you. You have other things to do, okay? That's why I have a job. Because that, if the responsibility falls on me. This is why you have to tell them if they are starting to miss a lot of levels, and don't do things that are just nitpicky. And what I mean by that is, like, if it's just one time that they miss one point or whatever and you have to drop the level, you can let them know. Generally, sometimes they're in a rush or whatever, and these things happen. But if you see that it is a chronic pattern, right, and they keep doing it, and they keep trying to appear like they're doing shortcuts and things like that. Talk to them. Sit down, make a point, go to their office, go walk into the hallway, wherever they're at. If they won't answer your email, because sometimes they won't, don't take that personally. It's just that some of them just don't like email, or their inbox gets flooded, and so things sort of get put to the wayside. Okay, just make sure that you make contact with them. Every provider should know what their coder looks like. That's what I say. They should be able to pick them up out of the lineup. Okay, if you are not communicating with your provider, if you are just coding what's there, that's wrong. If they're making a mistake, you've got to let them know, okay? And don't be afraid to tell them, because if you're afraid to tell them, they can sense fear, okay? And if they feel like they can tell you, no, you are going to code it this way because that's what I want you to do. If it is incorrect, you cannot code it the way that the provider wants it done because they say. You can't. You have to go what is based on the documentation. You have to go by the rules, okay? You can't be forced to code it incorrectly just because that's what the provider wants. If his documentation or her documentation is not supportive of that code or that procedure code or that evaluation and management level, you cannot code based on what they say. And do not let them try to make you do it whatever way that they want to, because they will try. I have seen a provider more than once actually try to do that. There was one that he actually said, well, we're going to get some real coders in here, and we're going to get them to work on this stuff. Excuse me. I am a real coder. Flesh and blood real coder, okay? So, and I have a very, very good knowledge base. I'm credentialed. I'm one of a handful of AHIMA members that are credentialed in this hospital. What are you talking about? So, but he was one of those ones that thought that he could say, well, I want this code. This is the code that I'm getting. No, sir. You cannot get that code. If what you are documenting does not support the code that you are selecting, I will have to change it to the more appropriate code. Well, he didn't like this. He's one of the 15%. But I'm just saying, like I said, communication is very key. And yes, if you see that there is a chronic pattern of them not meeting your level, based on whatever they're documenting, if you know that this level should have been a moderate and they don't have anything documented except for what you can only get which is a low level, then you got to talk to them, because there's a huge difference between getting a moderate level and getting a low level, okay? And heaven forbid you have to get a straightforward level, okay? Because then that's just heartbreaking. If a provider is due a moderate level and they only come up with a straightforward level based on their documentation, come on, man. You got to talk to them. You have to talk to them. And if that's not your way in your facility, if it is somebody else, then you need to talk to whoever it is, the lead, the data quality person, the clinical documentation improvement specialist, whoever does the communicating with the provider. If it's not on the coder, needs to be made aware, so that way that they can work with the provider to get them up to par, okay? Because it's all about being fair. It's all about, making sure that everybody is taken care of all the way around, all right? That's going to wrap it up for me, because now I just hit almost the 30-minute mark, and I don't want this to shut off on me. So anyway, I will go ahead and wrap this up, but thank you so much for watching a double dose of me today. And I really appreciate everybody that subscribed. We are 5 subscribers away from the coveted 2,000 mark. So I'm very excited. Anyway, I will see y'all again tomorrow, because I will be filming tomorrow. But if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. Okay, I will see y'all on the next video. Bye!